standards that are created with residency programs. And with that said, since 2004, I have been a surveyor for ASHP, and have gone to probably about 100 programs around the country to see how residents are trained or to be independent practitioners. Because with every residency program, there's really three basic outcomes that we look for. For one, to become an independent, confident practitioner, pharmacy provider. Two would be to be eligible for board certification. I feel it's pretty important to be board certified. Physicians get board certified, so why aren't pharmacists getting board certified? And lastly would be to prepare you for PGY2. If you want to get more specialized training, and well, there's got to be at least 10 to 15 different specialties now that you can get trained in. So I thank everybody for being on this call and having an interest. One thing you need to also consider is whether or not this might not be for you. So that's what we're going to talk about today in terms of what things you need to do to get prepared and why would one do a residency program.
Great, thank you, Dr. Sinnett. So I'm glad you brought that up about board certification and the important role that residency trained pharmacists can play in terms of ensuring that we're sort of up to par with our clinical expertise and improving patient outcome. So we all know residency is very competitive. There are much more applicants than residency positions available. So just for Montefiore Medical Center, which is located in New York City for the students that are joining us, on average, how many applicants do you receive? And how many of those applicants do you end up interviewing?
All right, yeah, and this is similar type of numbers that you see when I travel. I get that kind of informal survey in my head. I will tell you, when I did my residency back when, there were 185 residency programs. There's now close to 27 or 2,800 residency programs. So the growth is pretty rapid. But as Dr. Patel said, there's always individuals who do not get matched into a program. So we usually will get about 100 applications through forecast for residency training, and we end up screening out down to 20 to interview 20 candidates to match for PGY1 4 slots. So it's very competitive, and that's why I think it's important to talk about how you can get yourself on the top of the heap. In other words, your application is read first. Because remember, no one sees you when we're reading the forecast application. We're reading a biography, we're reading a CV, we're reading who you are on a sheet of paper. So you got to position yourself in a way that makes me raise my eyebrow and go, wow, oh, okay, let's do that. I will tell you, it's not just the grades, it's a lot of other things that we look at too. As a matter of fact, we have not interviewed people that had 4.0 GPAs because they didn't meet the other criteria that we look for too.
I'm glad you brought that up, Dr. Sinnett. So what is it that raises your eyebrow when you look through those applications? If it is, and our students definitely GPA, certainly that's something they think about. They're like, oh,
Yeah.
there was a semester when I didn't perform well, my GPA is not at 4.0. And I'm glad you're bringing that up because we do have residents that, have not had a 4.0 and still secure a position and have been extremely successful. So what raises your eyebrow when you see those 100 applications on forecasts?
Well, I will tell you, you got to have a lot of the programs vary on what they use for GPA. Some use a 3.5, some use a 3.3. And it's interesting, some of the pass-fail schools, we have other ways of looking at that as well. So you really need to look at that. But when we look at the GPA, we'll also concentrate more, as much or more, a little more on your pharmacy program. So your last 2 years of pharmacy school. We'll also look at your type of rotations. Now, again, don't be concerned if you don't have certain rotations before you get an interview. We all know that there's a lot of students and limited time to get a rotation. So we'll look at that. But all the things I'm going to mention there's not one thing that sticks out. It's a composite of everything. So it would be a grade, including the type of clinical programs that or clinical courses that you take, how well you did in therapeutics, for example, how well you did in psychology. Well, I'm not as concerned about that because also psychology is taken early on in school, and many of us are adjusting to school in the social manner and then also how to study. So I can understand that kind of perspective. The other things we'll look at are participation. Um, and if you're involved with a lot of the opportunities at FDU, so it would be all the organizations. Are you involved with a student society from New Jersey? Or if you're in New York, you go over the bridge to the New York State Council, for example. So we look at how involved you are. And I'm going to tell you, there's so many things to look at here. Because if you're involved and you go to a meeting, either virtually now or in person, we get to know you. We get to see the face. So we get to know that the look, the excitement of look in your face and how you interact, because that's a lot of it. Let me tell you, how someone reacts or how the enthusiasm of somebody is more important to me than what they know. It's actually that they want to learn more. That's actually a real important part for me. So it would be leader. Are you involved with a program? Are you a leader? Are you have an elected position or secretary or vice president, president? It doesn't have to be in my mind. It doesn't have to be a part of a pharmacy program. It can a pharmacy organization. It can be your sorority. It can be your fraternity. It could be at somewhere in a church program, for example, too. So we want to see what other things you're doing, not only because you're active and interested, but you can do time management. Because going to school and getting a doctorate, you guys, before I forget, when you go home, pat yourself on the back and congratulate yourself for getting through a really darn hard program. Because you got to remember, this is a tough program. So if you can be doing all these other things on top of that, residency is a hard program, a hard year. So if you can accomplish all these things, that's a thumbs up for me, and I know for a lot of other people. Are you doing things such as publications? Can you do a newsletter, or do you get involved with this? Again, involved with the chapters of our professional organizations. You can co-write an article with somebody. People are doing research. I think that's also good too. And again, goes why this is so. There's so many different things to consider. Is how you put this stuff on your CV is really important too. So things like that, publications, leadership. Also work experience. A lot of you get work experience. Why do we like work experience? You show up on time, right? You talk to people, and you talk to those very energetic patients. You know what I mean? Those ones where you're the one in the front, you got to deal with this patient. How do you deal with someone who's angry? Because that will show a lot in terms of how you deal with a frustrated provider or a patient, and how you can talk to them in an empathetic way, and time management too. So that goes a long way. It doesn't have to be hospital, community as well, even more community, because you're actually talking to people all the time. And that's a skill set that you really have to learn how to do if you want to be a direct patient care provider. The other thing I'm going to tell you, this is I don't know if it's in forecast application, but it could be on your CV. Things you like to do outside of pharmacy. I look at life in 3 sections. If you love coming to work, and you love going home, and you love sleeping, well, guess what? You love your life. And therefore, there's no other option. So what you do outside of your pharmacy life is as important to me as what you do in it, because you really need that time off to really kind of like resettle yourself, readjust your brain before you go back to work. Another thing too is that's a real icebreaker when you're doing an interview with somebody. I remember I was interviewing a candidate, and that's exactly one of the reasons why I brought her or asked her to come in for an interview. At her college, she founded some wind ensemble. I thought, wow, that's pretty cool. She played the violin, and she just started this group. And so, if you have an interesting hobby or in running, or if you're a marathon runner or something, because my boss is a marathon runner, he would just dive into that and go, and then you broke the ice. And now you have that conversation and that connection. So putting things like that, I think, is important as well. So
Great.
there's a
Thank you so
lot of
much.
things that come together.
Thank you, Dr. Sinnott. So I want to take a moment to welcome and introduce Dr. Zakin. She's here with us as well. She, as I mentioned earlier, Dr. Zakin, I gave a little bit of brief introduction about yourself in the beginning, but why don't you tell us a little more about your ambulatory care residency program at Atrius Health, what it entails. And I wanted the students to have a good understanding of the different types of residency program in terms of inpatient hospital experiences versus ambulatory care.
Perfect. Thank you. Good evening, everybody. I'm sorry I'm a few minutes late. So as Dr. Patel stated, I am faculty. I'm a professor of pharmacy practice at MCPHS University in Boston, and I'm the residency director for our PGY1 for MCP and Atrius Health. And Atrius Health is a ambulatory care, managed care organization. And the residency mainly focuses on ambulatory care, but it also has some pharmacy administration mixed in there, which is always a good aspect for candidates who are interested in potentially looking into some sort of becoming clinical pharmacy coordinator or a director of pharmacy in the future. We also incorporate informatics in there as well, which again isn't something that you always get a lot of in pharmacy school. So that's always something that's exciting to learn a little bit more about. Our clinics are mainly focused on diabetes and hypertension and hyperlipidemia. So those are the majority of the patients we do see. Sometimes we'll see patients for smoking cessation or, complex med management. But the others, I'd say 95% are the chronic disease states that I just mentioned. So our resident really gets a good understanding. Their first, after their staffing rotation, which is in an outpatient pharmacy, they spend about 10 weeks in pharmacy administration, and that's when they're learning all the ins and outs of the different insurances and what a PA is, and they're meeting with the different P&T groups of, say, in Massachusetts, Blue Cross Blue Shield and Harvard Pilgrim Healthcare. They also create and develop their own P&T, which they do all the work for, and then they present that at the official Atrius Health P&T committee with their recommendations. And so along with doing that, along the way, they're working with several other P&T committee members, as well as, say they're presenting it on a cardiology drug, the cardiology chief, to get all the information they need for that. And then they also have once that's complete, they also have their, DI rotation, which we kind of focus on mainly just drug information questions. Answering DI when you're a student is a lot different than answering DI when you're a pharmacist. And a lot of students, you might have great DI skills as a student, but when you go to answer one as a pharmacist, you might say, maybe it's not exactly what I'm supposed to be, how I'm supposed to be answering. So we focus on that, and then we continue to work on that throughout the rest of the year as well. And then the rest of the time, like I said, is spent mainly in the clinics, along with, then you do have a rotation in informatics for 6 weeks. So, if you have more of an interest in informatics and you want to spend a little bit more time in that, you could potentially do that as one of your elective rotations. We have 2 elective rotations that are typically in the months of May and June. And I kind of leave that up to the resident, and I say, choose something that's of interest to you. Do you want to spend another 4 weeks in informatics? Do you want to spend 8 more weeks in informatics? A lot of times, the resident will say, I kind of want to know what inpatient is like. This is all ambulatory care outpatient. I just want to see what 4 weeks of inpatient is. And so we can arrange to, potentially have you go just to a general inpatient unit, or maybe you want to go to a cardiology unit. So it's I just really leave it up to the resident, because it's their time to kind of explore something new that they might be interested in. The past 2 years, I've had the residents spend an extra 4 weeks in behavioral health because they really had an interest in BH. So that was nice as well, because that's also a component of the residency program as well. And I will just say that I agree with Dr. Sinnott in that on every single interview, I always ask the candidate, tell me what you like to do outside of pharmacy. I just find it fascinating. I want to, I go to the gym 5 days a week. I love to cook Italian food. I love to, travel the world. Well, used to travel the world. But I just think it's so nice because, inside your farm, you are a person and everybody has something. You do need that outlet. You can only work so many hours a day in a week. So what do you like to do in your free time? And I ask every single candidate that comes on. So I completely agree.
That's great. That's great to hear, Dr. Zakin. I think for our students that are listening in, it kind of gives them an idea of what interview questions look like. They're not always clinical. They could even be something simple like, what do you like to do outside of pharmacy?
Yeah.
And just to, think about it and make sure that the candidates are bringing themselves into the interview so you get a better idea of what the person looks like. It's really great. But one of the things that you mentioned about the rotations, and I think that's the beauty of residency programs, is that you get to the elective months, you get to sort of explore the areas that you have an interest in or something that you're curious about. And many times those elective months sort of set the stage for if the resident wants to do a second year in a specialty area, whether they want to go for a PGY2 or not. And I think that's really great when you get a chance to work with residency program directors to identify what areas you're curious about or want to learn more about. So I asked Dr. Sinnett earlier, and Dr. Zakin, I wanted to ask you as well, how many applicants do you tend to get through Forecast, and how many do you end up interviewing?
So I have a small program. I only take one resident per year. So I would say when I first started doing this, 14, 15 years ago, I'd get maybe 10 or so applicants because I think candidates were worried that, why would I interview them? I only have one spot available. At that point, residencies weren't really all that competitive. And so they had a lot more options. As time has gone on, and I think also getting the word out, about the program and people learning more about it, I typically have anywhere between 20 to 28 applicants a year. And I interview just about 10 roughly a year. So it's hard sometimes to really cut it down to 10, but it's at times it's pretty easy. When I read a letter of intent and it just says they want to do a residency because they want some extra training, to me, that doesn't really stand out. I'm looking for somebody who wants to do my specific residency. Why do they want to do the MCP 8 years health residency? What do we have to offer them? What is their plan afterwards, or what can they offer us? So I'm pretty good at this point being able to figure that out. And I'm curious this year if I will get more or if I will get less. And I wonder for all residency directors, just because nobody has to travel, it's free. So I don't know, I'm curious, but yeah, so roughly I'd say anywhere between 20 and 28. Last year I had 22, the year before 26, and I bring in 10 each year.
Glad you brought that up about letter of intent, because I tell our students that each letter needs to be personalized to the program and the position that you're applying for. It's not one letter sent out to everybody that you're thinking of applying for. So really looking into the program and focusing on why is this program a good fit for you is really important to put that out on your letter of intent. But our students also have questions about recommendation letters. So most programs require anywhere from 2 to 4 recommendation letters. And the question then becomes, who should we ask these recommendation letters from? Do you, want to look for different areas that can be highlighted for the candidate? And what about those students who've not had clinical rotations just yet? Mid-year is in December, but their clinical rotations could be scheduled post mid-year. How do they work around getting this recommendation letter? So any thoughts on that? We'll start with you, Dr. Sinnett.
Yeah, I agree. First of all, if you work, your employer, I mean, that's because they're going to talk to you about, or they'll hopefully talk to us about those things I mentioned, that they're on time, that you're a bright star in the front of the pharmacy, or in those things like that. I think those characteristics are very, very important to look for. I don't really, and some people at ASHP would agree with me, a professor may not be the best one because they don't see you collecting, analyzing data and putting it together into a plan. We want somebody that has somewhat of a baseline of that. No, don't get me wrong. You don't have to be perfect. The whole point of going into a residency is you learn this stuff. But we got to have an idea that you really kind of know how to start from somewhere and build something. And in other words, a patient's drug therapy. So anybody that, if you do have a clinical rotation, absolutely that. But somebody maybe in your lab at FDU, or people that see you analyze information and related to patient care. Another person would be somebody that you work with in research or work with longitudinally would be something to because they get to know you quite well. And I wouldn't be off having somebody who, if you have another degree, a lot of people have other degrees, somebody who's you've worked with as a research mentor or something like that in another grade, particularly if you don't have clinical rotations yet.
Yeah,
I make one more thing quickly with that. Please personalize them. I've gotten letters from addressed to somebody at Mount Sinai brought to me. Please, I just ignore those applicants because I said they weren't that careful. So I'm sorry.
No, I agree, and I would bring that point up too. Make sure that whoever you're asking to serve as a reference, that they address them to the correct person. And it even goes for your letter of intent. I've had letters of intent addressed to Dear Dr. Jones. That's not even close to my last name. So, you could tell that they didn't read it over or anything. But yeah, I would agree about the references. If it's a professor you did research with, say a directed study program or an honors program, and you published something or you created a poster together. But if it's just a professor you had in class, I mean, I don't know how big your classes are, but we have 300 students. If a student just asked me, I might not really know them all that well. Yeah. If I had them on rotation, I'm happy to write them because I spent 6 weeks with them. I saw them in clinic. I saw what they were doing, but if it's just a student that says, I had you in class, I liked your lecture, can you serve as a reference for me? It's a little bit hard. But definitely if you work in a pharmacy, sometimes students don't work in a pharmacy. We have a lot of international students who unfortunately can't work. Maybe they work at a clothing store or something, it's not pharmacy related, but at least it's their boss who can speak to their work ethic. Did they come in time? Did they do what they were supposed to do? So definitely people you've worked very closely with, and you want to make sure that they're actually going to write you a good letter. I've had letters come and I read them and I'm like, it's kind of lukewarm. Why would you ask this person? And again, maybe they don't have a lot of options, but you want to, and the other thing I will say is give them the deadline, but I always tell them to give 3 days earlier, just so it gets in on time. Yeah. Because again, a lot of times they're due around the holidays or right after the holidays, and people forget. So I always like to tell the students, tell them it's due 3 days earlier than it really is, and then it's on time.
Exactly.
Yeah, I agree. Dr. Hahn, I don't know if you wanted to chime in because we often get students asking us for recommendation letters, and if you wanted to just say something about those or provide any guidance.
I completely agree with just earlier comments on personalizing the recommendation letter as well as letter of intent. I did have student asking for the recommendation letter so that they can keep it and send it over so that they don't have to bother me every time they need it. So that's not going to work. You really have to personalize your letter of intent. Also, recommendation letter. Also, you have to give correct information to your references so that I, as a reference, can personalize a letter to you and highlight your strength and tailoring to that position. And also, when students ask for recommendation letter to faculty, I totally agree with that. The asking for letter to the faculty who are working longitudinally with the students, so that we can learn how they work, how they manage the work outside of the class. That's the one actually. That's the line we actually highlight in the letter, rather than GPA or this person attended a class. I know this person through a class. But if I know the student really personally and they have worked on project or even class project or outside of the class project, outside of the class longitudinally, that I can really highlight their strength in a recommendation letter and tailor to the position well.
Great. Thank you, Dr. Han.
And I just want to add one, I'm sorry,
yeah, go
can I
ahead.
just add one thing?
Of course.
If you say you're active in a club, like the ASHP student
Mhm.
chapter, the APHA student chapter, and you were the president, the vice president, or on the executive board, have your advisor write you a letter, because again, that's talking about your service and your commitment to extracurricular activity.
Mhm.
And then we have one follow-up question to that. Would it be helpful for a student to provide their CV or resume to the person that's writing the letter? Should they just automatically do that or wait for them to ask for it? What are your thoughts on that? Anyone? Dr. Sinnott?
I'd be asking for it. Yeah. I don't want to miss something really, really important. I mean,
Of course.
that I would be like, oh God, I knew that. I just forgot about it. So absolutely. Absolutely.
Of course.
And a matter of fact, I might even give you a little feedback on the CV while I'm at it. So that might serve two goals.
I agree. That's really important. So we talked about the application materials. This year, ASHP is fully virtual, and the residency showcase is fully virtual. So what can a candidate do to stand out in a virtual environment during mid-year? We'll start with you, Dr. Zakin.
I would say, first of all, come dressed like you are actually in person. Shirt and tie for the yes, thank you. Shirt and tie for the guys. Suit, obviously, you can put your suit jacket on, male or female. Hair combed, turn your camera on, look like you're awake, just like if you were in person. I would also make sure that you know the program you're speaking to. So again, I'm ambulatory care. I can't tell you how many times I've had patients come up and tell me, I'm so interested in your pediatric rotation. I'm looking forward to doing this. And I say, we don't have any peds. Oh, you don't? I said, no. And so for me, that's a red flag. So know your program. What specifically is of interest to you in that program? Have questions prepared about the program. You want to speak to the preceptor, you want to speak to the resident, you want to speak to the director. Obviously you're not going to be able to hand your CV or your business card, but you could always, say to them, when I apply, everything will be uploaded. Ask them if they have any questions for you. I think just kind of and being yourself, because it's, again, you're in front of this, it's a little weird. But just be yourself and make sure there's nothing crazy in your background. Make sure your name is normal. It's not like some wrestler name or something, it's actually like a real name. And I, like I said, just become professional, just as if you were in person. Because again, this is going to be your first impression, and it's going to be hard. I think a little bit, what I will like about this is I can actually write down the name now and write something, say, because I get these applications like, oh, did I meet them, or I did, but now maybe I'll be able to remember something a little bit more. So definitely come well prepared and dress professionally.
How about you, Dr. Sinnott? Anything to add to that? What will
Yeah,
make you really like?
Yeah, the virtual world's interesting, but I would totally agree. We can see you. So my wife's a kindergarten, first grade music teacher, and the kids are all making these faces and all. They don't realize that my wife can see them. So remember, you are being looked at, even though you might not be talking. I've been scrolling back and forth to see who's online and who isn't online. So I'm going to watch your expression. This is what I'm going to watch. See, the camera's right here, right? When you're looking over here, you know what I think you're doing? You're looking at this thing.
Yeah.
Take this thing and turn it off. Don't be tempted with the cell phone. Let me tell you, that is the most annoying thing when when I determine the cell phone is more important than this interview. Okay. One thing I do that I would suggest you don't look at yourself when I know what I look like. I don't know why I have to look at that. So you can look at the camera. Smiling and nodding, and there's a lot of communication skills you can use too. Becoming prepared and knowing about the organization. I get thrilled when people I know they went to the website, and I know they looked up Montefiore, they know what Montefiore is. But saying like, I'll agree, I'll go with you, Kathy, as far as, great, you have a great psych rotation. No, we don't have.
Yeah.
but we have all these other ones too. So, but being prepared about that is good, and ask lots of questions. ASHP has a lot of questions. Go online to their site. They have a whole list of questions that you can ask potential residency programs. And I'm thrilled that you took the time to do that. My ask too is this is also something I really want to get a point across. We can tell if you're doing a residency because you haven't figured out what you want to do, because you're not sure if you can get a job, that you, well, what the heck, I'll interview for managed care, even though they might have no idea what managed care is. It's pretty clear. So if you don't really, if you don't have a real a goal for residency programs, and maybe you shouldn't be interviewing. Maybe next year you could, because I also have a high regard for somebody who's willing to quit a job and go back and do a residency. That is a lot of guts, and I put people up a little bit higher on the list because of that.
And I would also say, do not chew gum when you're talking, because if you're chomping, blowing bubbles, snapping, whatever so no gum, not even a mint, because again, it's, extra saliva and it might seem a little odd. Nobody's going to smell your breath anyway, so it's okay.
That's right.
Agreed. And I think the name is really important too, because oftentimes we'll see our students and it just says FDU user, but going that extra mile and just updating it or changing it so that the program directors or preceptors on the other end can actually see who you are, put a name to your face. And now that is being on a virtual setting, I agree with you, Dr. Zake, and you can actually take notes, like their names and their notes, like red flags, like just saying Tracy came, but this was red flags. And I really, not probably going to pay attention to her application, or Michael showed up and I was actually very impressed. I'm going to wait to see this person's application and forecast. So I think you can take notes, and that's really good. So since we're on the topic of interview, a lot of programs do the personnel placement services at ASHP. So I have a twofold question. Is your program doing that? Is that something that you think residency candidates should be signing up for? And then my second follow-up question is about interviews. So I don't know if you want to talk about what interview days look typically for your program, and if they will look any differently for the following year, because if you're planning to do it virtually or in person, I'm not sure how your organization or institution is, what the rules and regulations are, but what will the interview day look like for this upcoming year? So Dr. Sinnott? Okay.
Yeah, this is a challenge. And I would say that unfortunately the sites have an advantage over the candidate, because if you're virtual, you can't come to the program. So we'll have a virtual tour on our site. So hopefully a lot of programs will do that. I think they got a drone and they went over Montefiore, and then, the camera going through the hospital, and also some words for our RPDs. But I'll first say, as far as PPS goes, I personally, this is my personal opinion, I'm not sure it's worth the money for a PGY1. Because PGY2s, there might be an advantage there because of a more one-on-one conversation. So I think the showcases are pretty good for PGY1s, but that's just certainly my opinion. It's more money you got to spend, and I'm not sure it's worth the money for doing something like that. As far as virtual goes, we're going to have the same thing. We generally will have 3 sets of interviews by 3 different groups, so we can get kind of a mix. They don't talk to each other, then we match and share notes. We'll have you do a very short a clinical pearl. And frankly, it's the same thing. You're really going to show your slides and you're going to present. We'll see your face while you're presenting. So I think it'll be great. And then we still may have a case study. So be prepared for a case. And I want to tell you, if someone gives you a case, we're not looking at everything. How can you know everything? I don't expect you to know much of anything, really, because there's so much you learn in FDU. You can't remember everything. And the whole point here is how you assimilate it. So that's what we're going to be looking at, how you think a problem through. If you miss a few things here and there, that's okay with me. It's how you think it through. So, but we can do that in a virtual world, but we can't really give you a tour, and we can't treat you to lunch. So that's an unfortunate part of our COVID world that we have right here. I don't know if Dr. Zakin has any other interesting things.
Yeah, I agree. I also agree about PPS. We don't do PPS, and I think for PGY1, it's not necessary. I think if you're doing a PGY2 or a fellowship or looking for a job, then I would say so. But a PGY1, I don't think you need to do it. And I'm hoping to keep our interviews the same. I like that idea about the virtual tour. I'm going to somehow see if I can get somebody to videotape something for me, and I can just post that somewhere. But it will be, you'll meet with the director of the clinical pharmacy program in the morning time, and then you'll go to your different breakout groups to meet with the different preceptors, as well as myself. And then we're going to, I always ask my candidates to do a 15-minute presentation in which they present. So we're still going to ask them to do that, and they'll present in front of myself, the preceptors, and the other candidates. And they will also do a case study as well that we will continue. And again, no lunch, unfortunately, but maybe in 2022, if we're lucky.
Yeah, that's a lot of money saved for you. So that's good in a way, right? But
Yeah.
it's unfortunate that the candidates don't get a tour of the live tour of the facility. But I know students have been asking a lot of follow-up questions to the information that you've been providing. So Dean Rossi, did you want to field those questions out? You're muted, Dean Rossi.
Okay, I have two questions from two different students. So the first one, I think I'll ask this of you, Dr. Sinnett, because you had mentioned about, experience and what to discuss, what to maybe put down on a CV, et cetera. So a student wants to know if retail experience is looked at, even though it's not hospital related. So do you suggest that they put that down or articulate to that? So if you could just address that.
Absolutely.
Good.
Again, I really think how your employer is going to be watching you dealing with that patient that always comes in complaining about something, and how you're able to handle that and diffuse maybe a tense situation. Your phone etiquette too. They're going to be listening to you over the phone. And then how efficient you are at work. Do you show up on time? Do you call if you're going to be late? It's amazing to me that people will not call and tell me they're going to be late, even though they have that phone surgically attached to their fingers. So I think those are the really important stuff. So we put community experience of high importance with community practice.
Okay.
Absolutely.
Good. Thank you, Dr. Sinnett. So I'm going to ask this question of both of you, Dr. Sakin and Dr. Sinnett. So a student is asking, what kind of advice would you give to someone who's interested in a residency, but not quite sure what area? They know where they want to do a residency, but they're not too sure if it's ambulatory care or internal medicine. Would you use a residency or try to secure it to explore hospital pharmacy further to see if that's really the career path they would like to pursue? So what is your opinion on that?
So I'm actually going to use myself as an example, because when I was in pharmacy school, I had only worked in community pharmacy, and I did my rotations in a hospital, and I knew I did not like a hospital setting. But then I had a rotation that was in psych, and I loved psych. And I thought to myself, well, the only way I can do psych is if I do an inpatient PGY1 residency versus a community pharmacy residency. So I actually interviewed for both PGY1 inpatient hospital residencies as well as community pharmacy residencies. And in the end, I chose community pharmacy just because I'm more of that outpatient people person. I want to, see patients. I want to continue to follow them up, and for me, the hospital setting just, I didn't get that feeling. However, if you're confused, I would think, if you do choose a PGY1 in a hospital, choose one that has either a longitudinal ambulatory care rotation, which maybe you're going to clinic once a week, or there is a required core rotation of ambulatory care, or perhaps an elective option to choose an ambulatory care. So you can kind of get the best of both worlds. And then if you choose to do a PGY2, you could say, I want to do a PGY2 in ambulatory care, or I can do my PGY2 in inpatient. If you did an inpatient, you go to apply for a PGY2 in AM care, at least if you had either that longitudinal portion from your PGY1 or you did your core or an elective as well in there, that kind of gives you a little bit more experience versus, if you had none of that in your PGY1. So, I think, if you don't get a chance to figure it out before mid-year or before you're applying, I guess apply to both and go on the interviews and ask lots of questions. And hopefully by the time it comes time to rank, you'll have a good idea of what you want to do.
Okay, thank you, Dr. Sakin. Dr. Sinet, did you want to weigh in on that same question? Okay.
Yeah, I actually will tell people, there's a couple ways to look at this. I'll ask somebody who's in pharmacy school, what do you want to do when you grow up, as I call it. And also, I want to be an oncologist, an oncology pharmacist. I said, well, why? Well, when I was 9 years old, one of my family members got sick. And I said, well, you're basing a 40-year career on something you learned when you were 9 years old. I said, maybe that's not the way to do it. So go to a program. We have 12 different distinct rotations and everything but really surgery. We don't have psych, we don't have urology, but we have pretty much everything else. So so if you don't know what you're doing, that's why you do a PGY1, because you want to really find out what really gives you that buzz, what you really love to do. Again, loving going to work and loving going home. So when I ask a resident, and we've had residents come in that really love critical care and they leave doing a PGY2 and AM care, because we have a 6-week AM care and you can do it again if you want. So you're going to change your mind a lot. The average, I guess you probably learned that FDU, the average person changes their careers like 9 times in their lives. So if you're more confused when you're during a residency, yeah, because there's a lot there. There's a lot of opportunity. Why not? Why not be confused? But you got to make a decision sooner or later. But at least in the beginning, it's okay not to know what's going on.
Okay. Thank you so much, Dr. Sinet. Okay, Dr. Patel, back to you.
Yeah, thanks. So yeah, it's really important sort of to look very closely at the programs and see what rotation experiences they offer and if they align with what your interests are or what areas you want to explore. It's really important. And then having that discussion with your residency program directors multiple times during your year. There's also important to make sure you're meeting your career goals. So I'm sort of going to switch gears a little bit and have you guys sort of talk to our students about what a resident's day-to-day life looks like. So Dr. Zakin, if you want to take over, what does your resident's day look like?
Mine might look a little bit different, maybe a lot different from an inpatient, because I think inpatient, they are there really early in the morning before rounds, and they're there really late at night, finishing up all their charts. So, our residency day typically starts about 8 a.m. in which they go in and, if they're on a clinic rotation, they have already reviewed the patients the day before, the night before with their preceptor. So they'll get in and, if their first patient's at 8, then they'll come earlier, obviously. And then they'll go in and they'll have clinic in the morning where they're seeing their patients. And then after clinic, then they'll go in and they'll write all their chart notes. They'll probably have a disease state discussion with their preceptor. They'll answer any drug information questions they have. So it's attend any meetings, potentially provide an in-service to any of the clinicians, depending on if it's the day they're having their internal medicine meeting. So it really just sort of depends on the day, but that's typical if you're in a clinic rotation. And I'd say they end 6-ish or so at night. However, then they go home and they prepare for the next day, finishing up anything that they didn't finish, maybe working a little bit on the residency project because they didn't get time during the day. Ours component actually, and I should have mentioned this early, is I have a large teaching component. So our resident is also an instructor of pharmacy practice. And so they are involved in the teaching certificate program in which they're required to give 1 lecture per year. They precept API students. They also teach in our seminar in the fall and spring semester, as well as in our advanced practice management lab. So, they might be grading things. They might be preparing for seminar. Maybe they're preparing their lecture. They're also required to do a home study CE. So they might be preparing their CE. If you're on your admin rotation, it's pretty much similar hours. That's a lot more meetings. You're not in clinic, so you're essentially in meetings all day. And then you're catching up and doing, your P&T review and any other administration work. But that's more meeting oriented versus the other clinic rotations, which you're more hands-on with the patients. Every Friday, our resident is on campus at the university, and that's their teaching day. So they spend the morning in our advanced practice management lab, which is where our P3 and our P2 and P4, P1 and P3 students work together to fill mock prescriptions and do patient counseling. And then in the afternoon, they're in seminar, which is our breakout of our therapeutics, where there's about 15 students and they're doing patient cases, holding journal clubs and things of that sort. So that's their Friday. So it's really Monday through Thursday, they're at the site, and then Friday, they're campus for their teaching.
How about you, Dr. Sinnott? What does your residence day look like?
Yeah, very similar in a lot of ways to Dr. Zakin's. But I will mention a couple of things. First of all, within the word residency is the word reside. So you're going to actually live at the hospital or live at your residency program. You're there to learn as much as you can. You got to stuff as much as you can in 1 year. Because after that, you don't have to do anything more for the rest of your career. I mean, well, you do, you should, but this is really a good way to shape how you're going to think and how you're going to manage your time and develop those interests. So I think it's really important to do that. Now, with that said, ASHP requires there's duty-free hours, duty hour obligations. We can't have you there for a certain amount of time. You have to go home after a certain number of hours. You only work a certain number of hours per week. So we're going to manage that too. And work-life balance, as I mentioned, is very, very, very important. So we'll be looking at those types of things as well. Well, with Dr. Zakin, I would just add on top of just kind of rephrase what Dr. Zakin was saying. It's the same thing. You have in a hospital like ours, we have is your core thing you're doing is your rotation. So, and that was already explained very well what happens. Gathering your notes, going on rounds, following up on your patients. But in between, you're going to go to a meeting. And you're also going to be working on your projects because there's a required project with every residency program. We actually have an outcomes research project as well as a performance improvement study, an MUE type of thing. So yeah, because you really need to learn those skill sets, I think. Learning about evidence-based medicine is a real foundation. And I would say Dr. Zakin's residency program is actually what that is. It's all about evidence-based medicine and learning that whether that paper really says exactly what it's supposed to say. So you'll be doing projects and programs, going to meetings, working on CE programs. So this is where a big important thing we look at is your time management skills, because this is the type of job you're going to have. You can't work in parallel. You're going to be working in parallel with the jobs you have. You don't just finish something and go on to something else. Finish something, go on to something else. You have 5 or 6 or 7 things going on at the same time, and that a residency prepares you for that. Residing and the duty hours will make sure you leave so you can go home and watch an hour of Jeopardy just to. At least that's what I like.
Just in case pharmacy happens to be on Jeopardy, right? So Dr. Sinnott, your program, I believe the residents are also do like an on-call duty where do you want to chime in a little bit about having
we
your
don't do
residents
that
on call?
anymore because
Okay.
we're re-looking at that, but some programs will do that. And I'm glad you brought that up, Dr. Patel, because programs, there are some programs I know that truly believe that, I don't know, you gain something by staying up overnight and taking call. I don't necessarily agree with that concept of staying overnight. We have our PGY2 do that for antibiotic approvals, but not for the PGY1s. You will be on call during the weekends, but not overnight. Yeah, but ask that question, because if you're not an overnight guy, most programs don't do that, but you don't want to get surprised when you come there and someone tells you you're working every other week and overnight. And you're like, what? So
right. So definitely research your program and write down what its requirements are. Most, like Dr. Sinnott and Dr. Zakin mentioned, all ASHP accredited programs require a research project, but then there might be other little things around like work every other weekend or work at the school on Friday or be on call every other Friday or, any of those. And having a good idea of what the program's requirements are. Also look at the licensing requirements for the program. So certain programs require you to be licensed by a certain date. And, making sure that you are prepared to sit for your licensing exam by what the program requires. So another question came through by a student. You may or may not know, but our students have the opportunity to do dual degrees when they're in our program. They can do a, MBA, Master's of Science. So do these, having this additional degree, in addition to PharmD, does that make their application packet stronger? Does it make a difference, or it's nice to have, not a need to have? What are your thoughts on that, Dr. Zakin?
I think it's nice to have. It's not required by any means. If that's something that, at least for my program, I don't know potentially for others, but if that's something you did in pharmacy school, I think that's fantastic. And, I would think, okay, you're definitely a hard worker. You were able to manage 2 degrees, especially while attending pharmacy school. Maybe you also worked part-time. Maybe you were also an advisor or a president of your chapter, student chapter. But I don't think it's required, but it's nice to have, and it can't help hurt, right? It can only help you, especially in the future when you're applying for a job. Maybe you want to become a pharmacy director, or a coordinator, and you have that MBA degree or a master's of public health degree if you want to do something with public health. So I don't think it would hurt by any means, but I don't require it when I'm looking at applications, and so, yeah.
How about you, Dr. Sinnott?
Yeah, same with me. Certainly don't get a degree so you can get a better shot at a residency. That would be the purpose. It would be that if you love population health, or as Dr. Zakin was saying, you plan on becoming a director. So those kinds of things are pretty important. But again, having that background, like we're really concentrating on outcomes research in our hospital. Having a master's in public health gives you that little baseline, so we can talk the same language a little bit quicker. But we will eventually talk that language, so it's not required.
Great, thanks. So we're almost nearing our time, and I wanted to sort of just leave it open to see if there are any other words of wisdom or any important information that we didn't get a chance to cover that you wanted to make sure our students leave tonight with to better prepare them for postgraduate training. So Dr. Zakin, any additional advice, words, or areas that you wanted to cover tonight?
Yeah, I think I will just, again, reiterate what Dr. Sinnott said is, don't do a residency just to do one, just because all your friends are doing one, or because maybe you can't get a job, because you will be miserable.
Yeah.
And your director and preceptors will be miserable, because it's a lot of work. You're there a lot of hours. It's a lot of time outside of work. Yes, there is work-life balance, but you might have to do something on a Saturday afternoon, which if you had a job, you wouldn't. You'd go to your job and you'd come home and you could put your feet up and watch Jeopardy. So do it if you want to do it. You have to have that drive. I've had so many good students on rotation. I say to them, what are you going to do when you graduate? And they say, oh, I'm just going to get a job. And I said, you don't want to do a residency? And they're like, I do, but I know I won't. I don't have the drive to do it anymore. I'm tired. I'm burnt out after 6 years. I'm done. So you have to have that drive and that motivation and want to do it. And I also think when you're choosing a program, again, I'm a program that only takes one candidate, and some might not like that. Some might want to be with a large group of people, many co-residents, so they have people to go out with, commiserate with, etc. Versus there's others who maybe just like working alone and having that undevoted attention from their preceptor. When they ask a question, they get a response pretty quickly because they're the only one asking. And I will also say, if you are able to and you are willing to, I'd say go anywhere in the country you can go. Don't stay where you are, because there's so many exciting opportunities elsewhere, and to take what you learn to a different part of the country, and then either A, you stay there because you love it and you got a great job, or B, you bring it back. That's priceless. I think if you're young, you don't have any commitments, do it, because now's the time to do it. Because when you eventually do settle down, you're not going to want to move around every few years. You're going to want to stay put. So if you have that chance, don't be afraid to go. It's only a year. So if you move to the middle of North Dakota and it's the best residency program, but you don't like the weather, it's only a year and you can come back. But I would definitely say take advantage, as Dr. Sinnott said, all the opportunities. If that means staying an extra 2 hours because maybe your director said, hey, I got this great meeting I want you to attend, or I want you to go see this patient with me, do it. Because again, this is your only time that you're going to have to do this. So take advantage of every opportunity. It goes by very fast. Look, we're already almost November and it's almost half a year. Feels like a lot longer though.
Yeah.
This year in particular. Go ahead, Dr. Sinnott.
Yeah, I'm glad you brought that up, Dr. Zakin. There are so many cool programs. There's a great program near Mount Rushmore. I mean, I've gone all over the country. I've had an opportunity to do residency accreditations in every state in the U.S. So the Dakotas are wonderful. Alabama, University of Alabama, if you like football particularly, you go down there. Chicago and California, you go on and on. There's just beautiful programs, and you can always come back. It's 1 year. And guess what? You might love it there and stay there too. I mean, you never know. But I'll leave with three things I thought of. Again, I want to emphasize first impressions are lasting. All right. So we talked about what you need to be prepared. One little side note, when you go in there and you're waiting in the, if you're waiting in the virtual class and there's people there, start up a little conversation with people. I mean, you know, if you're with a smile and people will remember that smile and that energy, because enthusiasm is the most important thing I have. You want to be, you're added to what Dr. Zakin is. You don't want to get a job, a residency. I don't know what else to do. That you're not going to be enthused going to a residency interview. You got to be really psyched. I want to do this because I don't know what I want to do, but I know I want to be a direct patient care provider. And you have 12 different rotations, and I can't wait. I don't even know where to start, but guess what? You got mentors too. And we're going to mentor you through the program. You're going to develop a lifelong collaboration with somebody in your program. With Dr. Zakin, you're never, if you go to her program, you're going to be talking to her for years and calling up, getting advice. We're going to be behind you every step of the way, because that's what our goal is. That's why we do this. I don't get paid any extra to be a residency director. I just love it. We love it. And we're going to make sure that you do the best you can to become that confident, kick-ass provider that's going to get that CV on the top of the pile. So enthusiasm, and remember, your first impressions are the lasting ones. So, but good luck, guys, and apply to our programs. But then go out west too.
I'm glad you brought that up.
Remember, you don't have
Dr.
to
Sinnott.
travel, so you can go anywhere, really.
Just cross over to the bridge, right? Yeah, and it's so important. You know, when as I was a student, I thought about residency, and I was like, oh, you know, you hear these horror, scary stories that you're going to be working through the weekend. You're not going to have time to watch Jeopardy. You have this residency research project to work on, and it really scares you. But I think you push yourself in it. You know, you come out of it, and you look back, and you have these lifelong mentors that you have built a relationship with. You've guided you, who will continue to allow you to grow in your careers. Is so much more than that 1 year that you spent there. So I always, you know, that's how I got through my residency for a year. I think I was almost ready to quit come January. I was like, I can't do this anymore. And I was like, you can do it. You only have 5 more months. You only have 5 more months. Look what you're getting out of it. And I think those horror stories are important to put behind and, you know, focus on what you get out of it when you complete your residency. But I don't know if Dr. Han, Dean Rossi, I know we do have a couple of our staff and faculty joining us as well this evening, if they wanted to chime in, provide any last words.
No, just Dr. Zakin really spoke my mind. Please know where you are getting into. Like, don't, you know, send out application with a mindset that I'll take a chance. Who knows, kind of mindset. Don't send out applications with that mindset. Please have a conversation, honest conversation with yourself. If what you are applying for really will make you happy, this is something that you really enjoy it before sending out application. Yeah, that's the advice I have for our students.
Okay, great, thanks.
Okay, I'd just like to, again, thank both of our guests. I think the information that you conveyed to our students is just invaluable. And for those students who attended, I hope it was a learning opportunity for you to gain some insight on how to start navigating your residency approach. But two things that just came to my mind in what was said. As we try to emphasize in the school, pharmacy is truly a lifelong learning profession. And it allows you to acquire competencies and proficiencies that are very portable, no matter what area of pharmacy practice you decide to venture down. So just always keep that in the back of your mind. And the other thing, and I think Dr. Sinet had mentioned, never underestimate the power of your soft skills, coupled with your clinical acumen, how you come across, how you just engage with people, your sincerity, your personality, that can go an awful long way. You could always learn something. You could always, take a course or get another certification, but the ability to communicate and come across as sincere, even when you're trying to help patients become compliant or engage with them just about, managing their illness or whatever, that soft skill is equally important. And I think that was emphasized as well. So I thank both of you. I'll just let you close, Dr. Patel. But again, to all the students who attended, I hope you found it valuable. And again, many, many thanks to our partners for giving back to your profession and our future pharmacists. So thank you.
Yes, I echo that, Dr. Zakin and Dr. Sinet. Thank you very much. We're forever grateful for you to carve time out of your very busy schedule and provide these insights to our students. And I'm sure you've glared at the names of those applications are coming through. They hopefully will be like, oh yeah, I remember seeing this name at the FDU residency panel. But we thank you very much. And if there are no further questions, I think I wish everybody a very good night.
You too. Thank you.
Thank you
you.
very
Thank
much.
Bye.
Best of
Bye-bye.
luck, guys. Best of
Thank
luck.
you.
Bye.
Bye-bye.